My name is Emily Landon. I am an adult infectious diseases physician and the hospital epidemiologist at the University of Chicago Medicine. This video will teach you everything you need to know about being an excellent hand hygiene observer. But first, why do we make such a big deal about hand hygiene, and why is it so important to our patients?
This is a simple illustration of a hospital setting with a patient space and a workspace. When a patient is admitted to a bed, they bring their microbiome with them, and as they settle in, their usual skin and gut bacteria, viruses, and yeast begin to spread throughout the room. Usually, our commensal bacteria is mostly harmless, but in a hospital setting, patients tend to have more gram-negative bacteria than usual, and resistant organisms take over as soon as patients get antibiotics. It doesn't take long. Only 12 to 24 hours of usual care for most of the surfaces in a patient's room to be covered. Healthcare workers come to work covered in our usual microbes as well, and we spread it to the surfaces we touch. But everyone shares this workspace, so it's not just our own microbes that we carry around on our hands. In a world without hand hygiene, healthcare workers bring this mix of microbes from the workspace into the patient's room every time we enter. As we work, we mix our microbes into the patient's and vice versa. Over the course of the day, hundreds of ins and outs without hand hygiene move the patient's unique bacterial flora outside of the room and onto the workspace where it can be shared with our colleagues and other patients. This isn't an OR, and we aren't trying to keep it sterile. But clean hands go a long way toward keeping the patient space separate from the workspace.
At UCM, we use the World Health Organization's 5 Moments for Hand Hygiene to help people understand when to clean their hands. We expect every healthcare worker to clean their hands before touching a patient, and that usually means cleaning their hands at the time they enter the room. We also expect healthcare workers to clean their hands before aseptic procedures or before putting on gloves, and after contamination or exposure to blood or bodily fluid. This includes after taking off gloves. We also expect people to clean their hands after touching a patient or after leaving the patient's room. At UCM, most inpatient areas use an automated aggregate monitoring system from Gojo to measure hand hygiene compliance. This system is wonderful because it gives us real-time comprehensive data about how many times hands are cleaned compared with how many times people go into and out of rooms. However, it's not perfect. It doesn't measure in-room hand hygiene events like before drawing blood or after emptying a Foley, and it can't tell us who is or isn't cleaning their hands. While we can get a lot of information from the system, it doesn't tell us why people aren't cleaning their hands, and some places just can't be measured this way, including the ER and the NICU and all of our outpatient areas. This is why we still need observations. There are 2 different kinds of observations, and you need to know about both of them. The first is called secret shopper observation or covert observation. In this situation, people being observed don't realize or know that you're watching them for their hand hygiene compliance. It's a way of estimating compliance when we can't use an automated system. It can also be used to validate an automated system and make sure it's recording things correctly. In this situation, the observer should watch each person for only a short time so they're not discovered. We recommend no more than 5 observations per healthcare worker. And it's really about just the facts being recorded. We'll get more into that in a minute. In this case, we really need our observations to be as valid and reliable as possible. Valid data reflects what actually happened, and reliable data means that if 2 observers saw the same situation, they would record the same thing. In other words, there should be no assumptions or guessing. If you couldn't really see whether or not someone cleaned their hands, then you shouldn't record anything. And you have to consider whether or not another observer would interpret the situation the same way. If you're not sure, then it probably shouldn't be recorded. Active monitoring, on the other hand, is an open process. It's a way for people to see what's happening on the unit, to better understand what's going on with the compliance, to identify barriers and discover ideas about how to improve things. In this situation, someone watches people do hand hygiene or not do hand hygiene, and they're welcome to interact with the individual, reminding them to clean their hands if maybe they forgot, and asking them why they might have forgotten or what made them remember to do it in this situation. It's important to provide positive feedback and to remain non-judgmental. The goal here is to record ideas and opportunities, not facts and numbers. This is about the story of why people are or are not cleaning their hands. It's not about the math. No matter what kind of observation you're doing, it's important to notice some key factors. Depending on the situation and the assignment, if you're doing covert observations, you may want to record whether or not the healthcare worker wore the correct PPE and whether or not they cleaned their hands before putting on gloves. If there isn't any PPE involved, it doesn't matter if the individual uses the dispenser outside of the room or inside of the room, but they do need to clean their hands before touching the patient or having meaningful interaction with the patient's space. Some people may have cleaned their hands all the way down the hall. As long as they haven't touched other things in the workspace before going in the room, it counts. If you can see into the patient's space, you might be able to observe hand hygiene before an aseptic task or after contact with blood or bodily fluid. Even if someone cleaned their hands when entering, if they have touched other things in the patient environment, they need to clean again before doing a clean or aseptic task. Something like drawing blood, accessing a central line, or looking at a fresh surgical wound. The same goes for after having potential contact with blood or bodily fluid, like emptying a Foley or cleaning a draining wound. When leaving the patient's room, healthcare workers need to clean their hands again, even if they were only in the room for a minute and didn't touch the patient, because most times they did touch the environment. This also needs to be done after removing gloves if they needed to put them on. It's definitely not okay to wear the same pair of gloves going from room to room, and sanitizing the gloves does not count. You may also be asked to record whether or not the hand hygiene was done correctly. Most times, people are going to use hand sanitizer. It's important that they put the entire amount that's dispensed on their hands and scrub for 15 to 20 seconds. The proper technique is shown here in the pictures. We want to see that they're getting hand sanitizer all over their palms, in between their fingers, in their fingertips, and especially around the thumb. A lot of people are going to miss the fingertips and thumb, and it may be important to record that if that's part of what you're looking for. If someone is using soap and water, we use the same process that you see here for getting the soap all over the hands. But before doing that scrubbing process, they need to get their hands wet and then spread the soap and the bubbles all over their hands, just like seen above, for 15 to 20 seconds, and then rinse it off. It's also a good idea to turn off the tap using a paper towel to make sure you don't recontaminate your now clean hands. This is what good hand sanitizing looks like. He's covering all the surfaces of his hands, getting in between his fingers, making sure not to miss those fingertips. And he keeps rubbing his hands together until it's dry, using the full amount that was dispensed in a pump. This is excellent. When doing covert observations for hand hygiene compliance, it's important to put the data that you collect into a database so that we can use it along with everyone else's observations that are working in the same area or at the same time. You'll learn in your one-to-one training about how to use a REDCap database or the iSCUB program, whichever one is being used in the area in which you're doing your observations. Just remember not to guess or assume anything. If you didn't see it, don't record it. Don't do more than 5 observations per healthcare worker in each session, and know which moments you're supposed to be focusing on before you start, so you don't spend too much time getting wrapped up trying to see moments 2 and 3 inside the room when it's just not possible. Active monitoring, on the other hand, is a lot more for your own benefit and your own style. It doesn't really need to be in a database, unless that's the way you like to keep it. I recommend that you keep all of your active hand hygiene monitoring notes in the same physical notebook or a digital folder, and that you at least write down the time and the location of each of your observations. I think it's important to make detailed notes about everything you're observing. Who or what type of healthcare worker is the subject? What's the purpose of the patient interaction? Are they responding to an alarm? Are they just doing routine care? Was it a planned entrance, or was it something that interrupted another task? What was the healthcare worker carrying or bringing into the room? Did they don and doff their PPE appropriately? Did the stuff they were carrying get in the way of what they're doing? Was there a place for them to set things down? Was it a good place, or was there potential contamination? Did the healthcare worker have to go out of their way to do hand hygiene, or was it within easy reach? Did you have to remind them to clean their hands? And then what happened when you talked to them about the hand hygiene issue? If they forgot, why did they forget? Were they thinking about something else? Were they too focused on the task at hand? Did they have too many things going on? Don't assume you know the answer just because you can see the situation. It's really important to ask. If they did a great job, make sure you give them positive feedback and ask them why they managed to remember. Were they planning on doing hand hygiene before they entered, or did it just come naturally? Do they use any mindfulness techniques to help remind them to clean their hands? And what did you learn about this observation? What ideas do you have now? Now, obviously, you're not going to be able to do this for big chunks of time. It's more important to just do this as often as you can and to write down the most important things that you learned from each observation. It may be a good idea to keep your notebook or your device with you handy so that you can incorporate this into other rounding and keep track of things as you go. I recommend that you spend a little time each week looking over the notes that you made and putting your thoughts together and sharing them with your team. Now that you know a lot more about doing hand hygiene observations, let's practice. In the following scenarios, keep track and jot down on a sheet of paper the sorts of things that you would record if you were a covert observer or if you were doing active monitoring. And let's see how you do. Did you get it right? This healthcare worker cleaned her hands all the way down the hall, but she didn't touch anything before entering the room, and no PPE was needed. She did a great job. Did you catch it? I'm going to assume this healthcare worker cleaned her hands before she put the gloves on. But after she finished drawing the blood, she took off her gloves and didn't clean her hands before going back to touch the patient. It may seem like a little thing, but it's really important to clean our hands every time we remove our gloves. She did a great job cleaning her hands before she came into the room to examine the patient, but when her pager went off and she got interrupted, she left the room and came back again without cleaning her hands. And while she was in the hallway, she touched a phone, some doorknobs, and all kinds of things outside of the patient space. This is pretty common, especially if we need to go and get something for a patient or get interrupted like this person did. But it's definitely not good hand hygiene compliance. This was a tough one. She did a great job doing hand hygiene before the aseptic task of collecting an arterial blood gas. And she did a really good job of hand washing after removing her gloves. In fact, I think her technique with the soap and water and the hand gel was really excellent. However, I missed the part where she was supposed to clean her hands on entering the room. Theoretically, she could have cleaned her hands way down the hallway, and we may not be able to know from our perspective and where we were standing in this scenario. If I was doing active monitoring, I would probably ask her if she cleaned her hands or if she may have forgotten, and why she forgot. If I was recording for covert observation, I would probably just not count that because I couldn't tell whether or not she did clean her hands. Just remember that hand hygiene is a habit. And like any other habit, we all want to have good ones, but we sometimes just don't get it right. Understanding the whole picture of hand hygiene and what factors help and hurt our compliance is a puzzle we're all figuring out together. The more we observe and share with each other, the more we're going to understand. Well, that's it. You've made it to the end. At this point, you've completed your online hand hygiene observer training. Next up is an opportunity to learn how to record covert observations and a chance to practice your skills with someone else checking alongside you. If you're just doing active monitoring, you're done. Thanks for joining our team.